Have you ever wondered if there is a natural way for you to overcome your PTSD? Hello, my successful and healthy earthlings. Mihaela Ragushi, a naturopath and founder of the Natural Health Podcast. In this episode today, I'm going to talk about a party drug that may be able to help you or someone that you know with their PTSD. In this episode, I'm going to go first through what is PTSD. Then I'm going to go and expose the party drug that can help you maybe with your PTSD. And then I'm going to give you 3 tips that's going to help and assist you with your PTSD. And at the end of this episode, I'm going to give you an opportunity to join a health and success oriented community, but join in the newsletter by clicking below. Welcome to the Natural Health Podcast, where we bring awareness of sustainable health and business in the business hustle space. Natural Health Podcast is perfect for all the high-performing, business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. Absolutely love, and appreciate your support. On Mondays here, I'm here to provide you with simple, savvy, and sustainable health hacks to optimize your health. In today's episode, I'm going to be talking about PTSD and a specific party drug that may be able to assist. And this all started off because I found a recent study this year that got promoted in Nature's magazine, which is one of the top quality journals here, the scientific journals. And it spoke about this party drug and how you may be able to help out with PTSD. But before I get into that, let's talk a little bit about PTSD. So what is PTSD? PTSD is post-traumatic stress disorder, and that's what I'm going to be talking about. It is a common and debilitating condition with immeasurable social and economical costs that affects lives of hundreds of millions of people annually, and you might just be one of them. There are a number of environmental and biological risk factors contribute to the development of PTSD, and poor PTSD treatment outcomes are associated with severe comorbid conditions that include childhood trauma, alcohol and substance use disorders, depression, suicide, and even disassociation. This is absolutely huge, and it is a huge concern even here in Australia. There's so many individuals that have PTSD, and when we think about PTSD, we may only think about individuals who have been in the army, police, air force, ambulance, doctors, and so forth. But even if you're not in one of those sectors, you may have PTSD due to some stressful event that has occurred in your childhood, in your adulthood, early adulthood. And this includes war, sexual abuse, any type of discrimination, even bullying to some extent, any type of events that were stressful at the time. And it's called a post-traumatic stress disorder because it's because the event occurred and then after it, the effects occur, okay? So it is therefore imperative to identify a therapeutic that is beneficial in those individuals with comorbidities that typically confer treatment, that are treatment resistance. So these individuals who have PTSD, they go and abuse maybe drugs, maybe even alcohol, maybe even individuals. They get depression, anxiety. They may even lead to suicide because it is hardcore what they've dealt with and they can't live anymore because to them, they believe that, it is easier to leave than to deal with what is happening inside of their head. And we need to think about how we are able to serve these individuals and help these individuals be part of our community or get back and integrate back into community so they're able to be part of community again and have a healthy life. The selective serotonin reuptake inhibitors, SSRIs, are essentially the approved first-line therapeutic for treatment for PTSD. So anyone who have PTSD are given SSRIs, antidepressants, right? However, an estimate of 40 to 60% of individuals do not respond to these compounds. That is a lot of individuals. So half the people that are given these actually don't respond well to it or don't want to take it. So evidence-based trauma-focused psychotherapies such as prolonged exposure and cognitive behavioral therapies are also considered to be a gold standard for PTSD. Many participants fail to respond or continue to have significant symptoms, and dropout rates are high in this because you can just imagine if these individuals are talking about something that has occurred and they don't really want to talk about it, and then someone's sitting in front of them and they have to talk about it, most people are going to drop out. They'll go to 1, 2, 3 sessions and then they're out, okay, because they're not seeing the benefits dramatically. So Novel cost-effective therapies are therefore needed, and this is why this study came about, because it is costing millions and millions, if not billions of dollars for Australians, for all around the world, healthcare sectors, to look after these individuals, to integrate them back to community, okay? So it's not even just a money thing, it's also for these individuals who have PTSD that it impacts their work life, so they may not be working. It impacts their family life, they may not be involved in a family, and it impacts the whole community because it affects them as an individual. They no longer feel worthy, they no longer feel like they are part of a community, they no longer feel like they can give back, because most of these individuals actually got PTSD by serving, which is actually quite it's quite saddening, because this individual served and then we don't serve them anymore, we just let them go, and it shouldn't be like that. And the thing that I want to put in here is also, we may soon be confronted with a potential enormous economic and social repercussions of PTSD. So I believe with the current pandemic, overwhelming high rates of psychological and mental health impairments could be with us for years to come and are likely to impact a considerable emotional and economical burden. The novel PTSD therapeutics are desperately needed, especially for those whom comorbidities confer treatment resistance. So this is absolutely needed. So let's go into actually what we can do for these individuals, or if you are that individual, what can be done for you. Let's talk about what party drug may help with PTSD. Okay, I know the topic is a bit like, what party drug? What is a party drug? So what am I talking about? So bear with me, and I'm going to go through this. It might be a little bit science heavy this episode, but bear with me because I'm going to try and explain it as much as possible. And if you have further questions, I'm happy to answer those. I am talking about, and I probably can't pronounce it right, but I'm talking about MDMA. Methyl endodoxyl methamphetamine induces serotonin release by binding primary to presynaptic serotonin transporters. MDMA has been shown to enhance fear memory extinction, modulate fear memory reconsolidation, and bolster social behavior in animal models. So the pooled analysis of 6 phase 2 trials of MDMA-assisted therapy for PTSD has now shown promising safety and efficacy findings. Okay, that is amazing and mind-blowing. In this current study that I'm going to go through, they assessed the efficacy and safety of MDMA-assisted therapy in individuals with severe PTSD. Participants were given 3 doses of MDMA or placebo in a controlled clinical environment and in the presence of trained therapy team. So PTSD symptoms were measured with the clinical administration PTSD scale for DSM-5, which is the CAPS-5, the primary endpoint, and also the functional impairment, which was measured by the Sheehan Disability Scale, SDS, the secondary endpoint, and they were assessed at the baseline at 2 months after the last experimental session. So let's go into a little bit about the study, okay? So essentially, the MDMA-assisted therapy for PTSD was granted an FDA breakthrough therapy designation, and the protocol was statistically analysis plan were developed in conjunction with the FDA. Okay, so the study. Let's go into the study. So this is all legit stuff. This isn't just some hippies getting together and being like, not that there's anything wrong with that, but this is scientific, and it's been actually featured in Nature, which is absolutely amazing. So participants were actually recruited from the 7th of November 2018 to the 26th of May 2020, with the last participant's visit concluded on the 21st of August 2020, so last year. This was a randomized, double-blinded study designed to compare the efficacy of MDMA-assisted therapy with that of placebo therapy. So this is like top gold star study because it's randomized and it's double-blinded. So a total of 345 participants were assessed for eligibility. 131 were enrolled and 91 were confirmed for randomization. It might not seem like a big number of individuals, but it's kind of rare to find individuals who have PTSD and are happy to do this. So it seems to be a pretty relevant study. So let's see what they did. In each experimental session, the participants received, so these are the individuals that received the MDMA. So there was the placebo and the MDMA, okay? So the ones that received it they received a single divided dose of 80 to 180 mgs of MDMA or placebo. In the first experimental session, an initial dose of 80 mgs was followed by a supplemental half dose of 40 mgs. An hour and a half to 2.5 hours after the first dose, so what they get is the 80, and then an hour and a half, 2.5 later, they get the 40. So that's at 120. In the second and third experimental session, an initial dose of 120 was followed by a supplemental dose of 60, so half. So it started off with 120 and now it's 180 combination. Each experimental session was followed by 3 90-minute integration sessions that were spaced 1 week apart to allow the participant to understand and incorporate their experience. The first integration session always occurred on the morning after the experimental session, and the remaining 2 integration sessions occurred over the following 3 to 4 weeks. So it's interesting, it's not just they were given the MDMA, they actually had sessions, 3 sessions after each one, which was quite interesting. The other one was the next morning, and the other ones were weeks following. So it wasn't just here's the MDA and you deal with it. It was actually supported. And if you want to know more detail about what they actually did, it's all in the study. So I'll quickly put here a little graph. The first one up there, as you can see, the blue is the placebo with therapy. The red is the MDMA assisted therapy. At baseline, they all had the same score of CAPS, okay? And as you can see, after session 1, after session 2, and after session 3, the gap became stronger and less of an effect, or there was a huge, because you can see huge benefit with the CAPC scores with the MDA assisted therapy. You can see the next graph with the SDS total score and the BDI2 scores. They're all the red is always lower than the blue, which is the MDMA assisted therapy if you're watching this on YouTube. So that's kind of like what was happening. But let's look at the safety, because a lot of individuals, when I've spoken to about them, they go, hey, what about safety, Mahela, right? What about safety? Number 1, okay, treatment emergent adverse events that were more prevalent in the MDMA study arm were typically transient. So that means they were coming and going. Mild to moderate in severity, included muscle tightness, decreased appetite, nausea, and a feeling of cold. Importantly, there was no increase of adverse events related to suicide that was observed in the MDA group. A transient increase in vital signs such as blood pressure and heart rate were observed in the MDA group. 2 participants had also an increase of body temperature. So there were some things, but they're all transient, okay? It's not something that you wouldn't get with other things. So they were the main ones that I spoke about. So they demonstrated that 3 doses of MDMA given in conjunction with manualized therapy over the course of 18 weeks resulted in a significant and robust a reduction of PTSD symptoms and functional impairment as assessed using the CAPS-5 and SDS respectively. MDMA also significantly migrated depressive symptoms as assessed using the BDI2. Of note, MDA did not increase the occurrence of suicidality during the study. This is mind-blowing, and you're probably listening are like, wow. And if you're interested, let me know, and I can probably do a podcast to go into the detail about how it actually helps and why MDA is actually helping these individuals. But you can just think about it from reading a little bit about it and reading about if you're on MDA, the fear response is definitely less, and therefore you're able to go into, the traumatic experience without it actually affecting you emotionally in a lot more detail and able to process it. But this can go into more detail, and it also has to do with neurotransmitters and our biological effects it has in our body. But given that PTSD is a strong predictor of disability, so individuals who have PTSD, they have an opportunity to get a disability. This is both for veterans, so individuals who have served in the army and so forth, and also the community population. It is promising to note, this is what the study says, I'll read it straight from them. It is promising to note that the robust reduction in PTSD and depressive symptoms identified here is complemented by a significant improvement in SDS scores, for example, work and or school, social and family functioning. Given that more than 80% of those assigned to PTSD diagnosis have at least one comorbid disorder, the identification of therapy that is effective in those with complicated PTSD and dual diagnosis could greatly improve PTSD treatment. Additionally, studies should therefore be conducted to evaluate the safety and efficacy of MD-assisted therapy in those with specific comorbidities. So this is absolutely amazing that they're saying that these studies are coming out showing that there is a 3 doses during 18 weeks that can assist that, compared to taking SSRIs and doing the cognitive behavioral therapies that people don't show up to, okay? And this is given 3 doses in 18 weeks, and you're showing these amazing results. I mean, what individual with PTSD would say no to that, with no safety concerns besides the ones that I mentioned, which are transients, which go away within a few days and have no long-term effect. This is absolutely amazing. And I can just imagine, if you're listening, if you have PTSD, or if you know someone who has PTSD, this gives you that hope that you're looking for. It gives you that little hope that you're able to get back into community, get back to your family, get back to work, and be the self that you were prior to PTSD. Okay, let's look at 3 tips to assist you with your PTSD. Number 1 is, I would read this study. I would look into it. I would find someone who's able to assist you with this. Stay on top of what's happening here in Australia. If there are any psychiatrists, psychologists, or any individuals that you know that are working within the guidelines and are able to assist you with using MDMA, and when it does get approved here in Australia, jump onto that. 2 is, mention these to your psychiatrist, psychologist, anyone that's treating you. Talk to them about it. Let them know that you are open to it if you are. And number 3 is seek help. Don't be alone. There is things out there. There is assistance out there. There are psychologists, psychiatrists, counselors, spiritual healers. Whatever your go is there is a way out. You're not stuck there, okay? Make sure that your sleep is on point. Make sure that your nutrients is on point, that your mental health is on point, that you are looking after yourself, that you're being proactive, because you need to take control of your health. So there are some little tips there for you to assist you with your PTSD. So in summary, what I want to say is MDMA-assisted therapy induces rapid onset of treatment effectively, even in those with severe PTSD and in those with associated comorbidities, including dissociative PTSD, depression, history of alcohol abuse and substance abuse, and childhood trauma. Not only is MDMA assisted therapy an effective in individuals with severe PTSD, it may also provide improved patient safety compared with current first-line pharmacological and behavioral therapies. MDMA assisted therapy has the potential to dramatically transform treatment for PTSD and should be looked into and evaluated for clinical use. And I hope that this is something that psychologists, psychiatrists, individuals who are writing policies and improving things are listening to and keeping an eye out. And if you know someone that is in that line of work, pass this on to them. They need to know about this research. So there you have it. Love, like, share, do what you do best, the Natural Health Podcast. And if you know someone who can benefit from this, share, send this to them. They need to hear this. This needs to be the first line treatment for PTSD. So there you have it. And if you want to be part of a success and health oriented community, join the Natural Health newsletter by clicking the link below, and you'll be sent a newsletter every Friday with information to provide you with these types of studies, updated studies, bonuses and specials from our guests and our products into your inbox every Friday. And remember, the missing link between failure and success is your health. Content and information provided here is opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Health Podcast, Mahela Raguse, any guest or contributors to the Natural Health Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Health Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mihaela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in educational content.